Thank you for watching the video. This is YouTube Medical University. I never would have thought that signs appearing on places like your eyes, elbows, or Achilles tendon could indicate a risk of plaque buildup. As people say, we age along with our blood vessels. As we get older, our blood vessels age, plaque and fat accumulate, and when they become clogged, the risk of heart attacks and strokes increases. To live vibrantly and authentically in your later years, traveling, savoring great food, and enjoying life, it's very important to prevent the aging of your blood vessels. However, with arteriosclerosis, if your blood vessels become clogged, the symptoms can be severe, and by that time, it's often already too late. There are almost no symptoms right before a blockage occurs, but there are some signs you should pay attention to, and also these kinds of I think it's important for everyone to know that if you have certain physical characteristics, you might be at higher risk of your blood vessels becoming clogged in the future. I've seen families who regretfully say, if only we had known sooner, we could have helped our loved ones. For example, please take a look at this image. This is called xanthelasma, which is a change where fat or lipids accumulate on the eyelids. Please take a look in the mirror and check if you or anyone around you has this characteristic. Conducted in Denmark in 2022. The study found that people with this change called xanthelasma compared to those who do not have it. Whether they were in their 40s, 50s, 60s or even 70s, there are reports that their risk of future myocardial infarction and related death was higher. For example, among people in their 70s, those without xanthomas had a 19% risk of myocardial infarction over 10 years, while those with xanthomas had a clearly higher risk at 28%. Knowing this may make you realize you need to be more cautious than others, as it can cause arteriosclerosis. Other factors like blood pressure, cholesterol and blood sugar levels. Don't you think your mindset might change to being more careful? By the way, if this xanthelasma appears on areas like your elbows or knees, this is called familial hypercholesterolemia, where cholesterol levels become high due to genetic factors. It's part of the disease's diagnostic criteria, along with similar changes. Can you see that the Achilles tendon is clearly thicker? If you look at the thick part of the Achilles tendon on an X-ray and its thickness exceeds 8 mm in men or 7.5 mm in women, this is called Achilles tendon thickening. And this is also included in the diagnostic criteria for familial hypercholesterolemia. Who would have thought that changes in the elbows, knees or Achilles tendon could be a sign of high cholesterol or a hereditary disease? At YouTube Medical University, we always explain that knowledge can be a weapon. We share useful knowledge like this that can help you become healthier starting tomorrow. So if you'd like, I'd be happy if you subscribe to the channel so you don't miss any new videos. With that said, this time in the first period, I'll talk about 3 signs that indicate plaque is about to clog your arteries. Then in the second period, I'll discuss the causes of plaque. I'll introduce methods to lower cholesterol and triglycerides. I'll also reference the book The Truth and Lies of Health Information taught by 425 specialists while explaining. This may be a bit long, but I hope you listen to the end. Let's begin. 3 signs plaque may soon clog your arteries. Here's the first one, intermittent claudication. The name intermittent claudication might sound a bit confusing, but it's actually simple. Your legs hurt when you walk, making it hard to continue. That's the symptom. Our bodies are filled with blood vessels, and if you count capillaries, their total length matches Earth's circumference. Blood vessels could circle the Earth 2.5 times, and the farther blood vessels are from the heart, the thinner and finer they become. The thinnest blood vessels from the heart are the ones in your toes. When your triglycerides or cholesterol are high, the risk of diseases where these blood vessels get clogged increases, and actually symptoms can sometimes first appear in your feet, which are farthest from the heart. Your feet are often called the second heart because they help pump blood from your feet back to your heart. If you ignore the early symptoms that I'll talk about next, in the worst case, blocked blood vessels in your legs can lead to amputation. I've seen many cases like that. So what kind of symptoms appear when the blood vessels in your legs start to get blocked? That happens when you start walking. After about 5 minutes, you may experience calf cramps, leg cramps, or pain in your legs. If you stop and rest for about 10 minutes, the pain goes away. So you start walking again, but as you walk, the pain comes back and you have to stop and rest again. In situations like this, it's possible that the blood vessels in your legs have become narrowed. Why? Why do these symptoms occur? It's because when you move your legs, you use your leg muscles. To move your leg muscles, you need a lot of energy, so you need a lot of blood flow. However, because the blood vessels in your legs have become narrowed, there isn't enough blood flow, which causes symptoms like pain or cramping in your legs. If you think about the reason behind it, it might be easier to remember. Also, there's a way to check it quickly without having to walk. That is by checking if your feet feel cold. If your feet are extremely cold compared to the warmth of your hands and feet, or if one of your feet feels cold. This could also mean that arteriosclerosis is progressing and blood flow is decreasing. Please try touching your feet while watching this video. There are also other methods like this. As shown in this photo, try touching the area between the base of your big toe and second toe on the top of your foot with your index and middle fingers. You might be able to feel the pulsation of the artery. This is a normal reaction. As arteriosclerosis worsens, you may not feel the dorsalis pedis artery on the top of your foot, indicating the disease is progressing in your foot arteries. It's a sign, so please try it. However, feeling this blood vessel can be difficult if you're not used to it. Don't assume your artery is blocked if you can't feel it. If you think something's wrong, consult a hospital. You might think foot symptoms aren't serious and will improve on their own, but making that judgment yourself could lead to pain when walking. If you have these kinds of symptoms, after gathering 100 people and following up, 5 had blocked leg arteries and needed amputation. And out of those, 3/4 or 75% in the future. There are even research results showing that 75% of those people later developed diseases where the blood vessels in the heart or brain became blocked. It's just your legs, but they're still important. If you have any of the symptoms I just mentioned, please consider seeing your regular doctor or a nearby internal medicine or cardiology specialist so you can keep walking energetically on your own legs in the second half of your life. There's a simple test called the ankle brachial index that checks your blood flow. This method compares blood pressure in your arms and legs to assess leg blood flow. If the results of that test show that the blood vessels in your legs are actually starting to get blocked, we use a treatment called catheter therapy, which involves using a stent to widen the narrowed blood vessels. These kinds of treatments are performed. Signs that plaque is about to cause a blockage. The second of the 3 signs is this: transient ischemic attack. Heard of it? The name is complicated, but these are the symptoms. You may briefly have trouble moving your body, experience numbness, or have difficulty speaking. You had symptoms, but after about 5 to 10 minutes, they completely disappeared. When symptoms like those of a stroke appear temporarily like this, it's called a transient ischemic attack. What's happening in the brain is that tiny plaques, blood clots or thrombi, temporarily block a blood vessel in the brain, but then they gradually dissolve, so the symptoms remain temporary. Some people might think it's fine if the blockage dissolved, but actually, this often serves as a warning sign for a stroke that could happen later. Out of sight, out of mind. Don't just ignore it because the symptoms went away. If you notice anything like this, please consider seeing your regular doctor or a neurosurgeon right away. There is something called the golden time for strokes, that is 4.5 hours. When a stroke occurs, brain cells become deprived of oxygen and start to die rapidly. Once this damage happens over time, it can't be reversed, and permanent after effects like paralysis may remain. However, if the blood clot can be removed or dissolved with medication soon after the onset, the brain cells that were about to be lost, it is said that the brain cells can recover and symptoms like paralysis are more likely to improve. That's why, as I mentioned earlier, people who have symptoms such as a transient ischemic attack should basically be hospitalized and undergo various tests to check for the risk of blood clots. If necessary, they may be prescribed blood thinning medication to help prevent future strokes. Let me introduce 3 typical symptoms of a transient ischemic attack. The first one, surprisingly, is related to the eyes. You might have trouble seeing from one eye, feel deep eye pain, or suddenly lose vision. If these symptoms improve within a few seconds to a few minutes, or at most within an hour, this could be a warning sign of an impending stroke. This symptom is called amaurosis fugax. Of those who have the symptoms I just mentioned, about 10 to 15% develop a stroke within 3 months, and half of those strokes occur within 2 days after the eye symptoms appear. The cause of this kind of amaurosis is carotid artery stenosis, which means that the 2 important large blood vessels in the neck are starting to get clogged by cholesterol and plaque. Whether the blood vessels in the neck are starting to get clogged can be determined by doing a carotid artery ultrasound, which is an ultrasound of the neck. Even without symptoms, data shows about 10% of elderly people have narrowed neck blood vessels. For more details, watch my video, Signs that your neck blood vessels are about to get blocked. Another sign of a transient ischemic attack is slurred speech. You might wonder, is that person drunk? Their speech is slurred. In such cases, it could be a sign of a stroke or a transient ischemic attack. Besides slurred speech, they may also have trouble finding words. Suddenly being unable to speak, known as aphasia, can also occur as a symptom. You might have the image in your mind but can't find the words, like not being able to say remote control and just saying that thing, that thing. Those kinds of symptoms could actually be signs of a stroke as well. There's a simple test to check your articulation where you repeat the word pataka several times. Pataka, pataka, pataka. If you suddenly can't say this properly, it could be a sign of dysarthria, which is a possible warning of a stroke. Please try checking yourself. The last symptom of a transient ischemic attack is numbness or paralysis. A characteristic is that it often appears on one side of the body. You may feel numbness in a hand, leg, or your mouth and have trouble using your strength. Those symptoms could also be stroke warning signs. In fact, based on my experience, there have been people who only had numbness in their mouth, and when they got checked, it turned out to be a stroke. When you hear the word stroke, you might imagine suddenly being unable to walk or having major symptoms. But it's actually quite common for minor things to be symptoms as well. Sudden numbness on one side, weakness, difficulty seeing, or slurred speech. Please remember these symptoms. Here are 3 signs that the plaque is about to clog your artery. The third one is this: feeling chest discomfort when walking. If you've been studying at YouTube Medical University, you likely already know this. With angina, when the blood vessels in the heart are about to get clogged, you start to feel chest discomfort when walking. The heart is a mass of muscle. It contracts thousands or even tens of thousands of times a day. Because of this, it uses a lot of energy and has a rich blood supply. When the blood vessels that supply nutrients to the heart become clogged, you may feel chest discomfort when walking. Those kinds of symptoms can appear. However, the troublesome part is that even if the heart's blood vessels are half clogged, there are no symptoms. It is said that symptoms are more likely to appear when about 3/4 or 75% of the blood vessel is clogged. And what's even more troublesome, in my experience, is that some people say things like, "My left shoulder hurts," or "I have pain around my jaw," and when we actually check, it turns out that their heart's blood vessels are starting to get clogged, even though these aren't typical chest symptoms. These kinds of atypical symptoms, not in the chest but in the shoulder or jaw. It's more common for women, the elderly, and people with diabetes to have clogged blood vessels without symptoms. So please pay attention to this. If you have symptoms like chest pain, a feeling of pressure, or if these symptoms persist, it can increase your risk of a future heart attack. In fact, about half of the people who have had a heart attack experience symptoms 1 to 2 months before. They must have experienced symptoms like the ones I just mentioned. Knowledge is power. Make sure not to overlook these symptoms. If you have any heart-related symptoms, please consider visiting a nearby cardiology clinic. If an electrocardiogram, heart ultrasound, or catheter exam reveals clogged blood vessels, they can be widened with a catheter, balloon, or surgery to connect vessels. Treatment and procedures will be done. This reviews the first lesson. As signs that plaque is about to clog the vessels, when the blood vessels in the legs are nearly blocked, intermittent claudication can occur, causing pain or cramps in the legs when walking. Secondly, a transient ischemic attack can cause sudden difficulty seeing out of one eye or weakness. I explained symptoms such as slurred speech. Third, angina. You may feel chest pain or tightness when walking. I also explained about symptoms like those, as well as atypical pain in the shoulder or jaw. So, it's important to notice and treat the signs right before a plaque gets clogged. However, what's really important is to prevent arteriosclerosis and the growth of plaque in the first place. Hospitals, by their very structure, receive medical fees by diagnosing and treating illnesses. Hospitals often don't explain how to prevent diseases. The concept of mebio refers to the state before illness. It's very important to prevent illness at an earlier stage and lower future risks. So, in the second lecture, we'll focus on how lowering triglycerides and cholesterol, which are currently getting a lot of attention, can reduce the risk of future vascular diseases and may even help with blood pressure and stress. I'll introduce some special foods. In fact, this is something I personally consume every day. It's fish. The oil found in fish, called fish oil, is a magical oil. Omega-3 fatty acids called docosahexaenoic acid, and icosapentaenoic acid, contain very good oils that belong to this group. They are said to be especially abundant in blue-backed fish. Recently, more and more new research has been conducted on these omega-3 fatty acids. They are expected to lower triglycerides and cholesterol, reduce blood pressure and heart rate, and are even being considered as a depression treatment. That's the kind of nutrient it is. A highly reliable meta-analysis of 11 studies found that people who eat fish more than 4 times a week compared to those who don't have a lower risk of heart conditions like myocardial infarction, where the blood vessels in the heart become blocked. Their risk of these diseases is reportedly reduced by up to 21%. Additionally, the risk dropped by 5% for every extra 100 grams of fish eaten per week, suggesting that eating more fish is increasingly beneficial. Isn't it a waste not to eat fish? So, which nutrients in fish are beneficial? Many studies have been conducted, but the nutrient that stands out is eicosapentaenoic acid, which is one of the omega-3 fatty acids, mainly in the United States. Clinical trials in 11 countries had about 8,000 people take 4 grams of eicosapentaenoic acid daily. They compared people who were taking it with those who were not. After 5 years, the group taking eicosapentaenoic acid versus those not taking it, their triglyceride levels fell by about 18%, and reports show myocardial infarction risk dropped by up to 25%. Eating fish, and especially eicosapentaenoic acid, may help prevent arteriosclerosis in the future. And that's not all. There are several highly reliable studies called randomized controlled trials that compared a group taking omega-3 fatty acids with a group taking a placebo. According to the results of those studies, omega-3 fatty acids reduced low-density lipoprotein cholesterol by about 15 over 6 months and lowered systolic and diastolic blood pressure by 4.5 and 3.1 respectively. There are research results showing that heart rate could be lowered by about 1.6 to 2.2 on average over 2 months. As a doctor, lowering bad cholesterol by 15 and blood pressure by 5, I feel every day just how difficult this really is. Even with exercise, it doesn't go down easily, and even if you work hard on your diet, it still doesn't go down much. Many people feel that way, but they don't want to depend on medication. For those people, I think it's really important to consciously take omega-3 fatty acids like these. In addition, a meta-analysis paper was published that gathered several studies suggesting that administering eicosapentaenoic acid to people with depression may improve the effectiveness of depression treatment. For those with depression, adding 0.07 ounces of eicosapentaenoic acid daily to their usual medication. Reports show that administering it together raised depression improvement rates compared to not administering it. It's expected to help with blood pressure, cholesterol, and depression, and is getting a lot of attention now. It's a nutrient. Ideally, it's better to get these kinds of nutrients from natural foods, from a natural diet. However, it's quite difficult to consciously eat blue-backed fish. If you clearly eat less fish than usual, I think it's a good idea to consider taking supplements. According to the United States Food and Drug Administration, the general public can take a total of 3 grams of eicosapentaenoic acid and docosahexaenoic acid per day, and up to 2 grams of that can be from supplements. And if you have advice from a doctor, it's said that you can take up to 4 grams per day, so I think it's safe to take up to 2 grams per day as a supplement. As for eicosapentaenoic acid, which I mentioned earlier as being particularly effective, it's actually used as a prescription medication in Japan to lower triglycerides. If you're concerned about triglycerides or cholesterol, please consult your doctor. Please decide together with your doctor how much you should take. There's one thing you should be careful about when getting omega-3 fatty acids from fish. That is mercury. Mercury is a metal that accumulates in fish through the food chain. Trying to get omega-3s but consuming too much mercury can lead to mercury poisoning. You may have numbness in your hands and feet, vision or hearing problems, and memory loss, and you may also develop symptoms like headaches and dizziness. Generally, the following are said to contain a lot of mercury. Types of fish: large tuna, splendid alfonsino, swordfish. Relatively large fish have increased amounts of mercury as a result of the food chain. Fish that are considered to have relatively low amounts of mercury are: types of fish include sardines, mackerel, and horse mackerel. Mercury levels vary by country of origin, so caution is needed. And similarly, supplements that are made from fish as raw materials may also contain mercury, so you need to be careful about marine pollutants and the oxidation of oils as well. How was it? I discussed 3 signs your arteries may be clogging with plaque and highlighted popular supplements. I also explained about omega-3 fatty acids, docosahexaenoic acid and icosapentaenoic acid. At YouTube Medical University, we offer data-driven videos to help you get healthier starting tomorrow and share tips on disease prevention. As a doctor, I take responsibility for sharing this information. Please subscribe to the channel to stay updated on new videos. And whether it's a thumbs up or a thumbs down, your feedback on this video will help me improve for next time. And in the comment section, please share what you felt, what you learned, and any healthy habits you're practicing. It should also help other viewers. See you in the next video.